Hi, and welcome to 21st Century Healthcare Consultants' official podcast, Home Care Today. I'm Kate Rose, your host, and I am absolutely thrilled to have our guest on with me today, Thomas Rose, who's the CEO and President of 21st Century Healthcare Consultants. Welcome, and thanks for taking time out of your busy schedule to join me on our podcast. I know our viewers are excited to hear from you, and I want to hear from you as well. So welcome. Thanks for being here.
Thanks for having me.
I know you're a very busy person.
It keeps you that way. That's a good thing.
It does. It does. We were chatting before the show about so many things that we could go into, but I want to let this just be a time for you to take some space with your listeners and to give us an overview of how things are going at 21st Century. Who are you? What do you do? Where do you come from? What's 21st Century's position in the market? Talk to us like a CEO. Tell us what's happening.
Well, thanks. And good question. So 21st Century has been in business for probably almost 30 years, and we're the nation's largest startup consulting business for healthcare, home care, home health, and hospice agencies. We probably do about 650 agencies, new agencies a year, that we get through licensing, state licensing, and accreditation if they're going that route, or for private pay.
Well, tell me, let's back up a little bit then. So obviously 21st Century has been a standard in the industry for, you said, almost 30 years. Well, what main services does 21st Century provide?
So for services, 21st Century has a core to where we help new agencies with their startup process. And that can be from corporate formation and getting their EIN numbers, getting their corporate documents put together, and then submitting their applications for state licensure. And with state licensure, there may be a survey required, maybe not, which we help prepare them for that. And if they want to go on to home health, which is Medicare certified, then we help them through the accrediting bodies to get their preparation for survey and accreditation. And if they're not doing that, then they may just have to go through survey based on if their state requirements are for accreditation or not.
So as consultants, you're able to take someone who's fresh to the business, fresh to the industry, with a little bit of background research probably to decide that this is what they want to do, but you're able to actually walk them through the entire process from application to operation, is that correct? And then beyond in terms of support with making sure that compliance and the necessary things are in place to keep them not only successful, but also legal and compliant with all of the different regulations and things that obviously overlay the industry.
Yeah, that's correct, Kate. And typically our clients for startup side of the business, they may be an entrepreneur that has had a family member that's needed home care, so they're familiar with it. They could be a clinician that has been in the industry, or a caregiver that's been in the industry and worked in it and wants to start their own business. Or it could be someone who's just looked for an opportunity and wants to start a small business, and they've seen the growing market for home care, and they come to us for that. So we get a real variance in what level of experience people have and a background. So some may not have any business skills whatsoever. If you've been just a caregiver, you know you love helping and taking care of people, but you don't know the business aspects. So we might find that we're giving them more coaching on sales, marketing, business management, functions of how to run a business, and also for the legal components and regulatory requirements that go along with it. So it just depends on where the person comes from, what their background is.
So what I think I hear you saying is that you're able to walk in the weeds with people from across, all walks of life. You're able to help identify what that individual most needs, and then you're able to bring the services, the consulting, the advice, the monitoring, and so on and so forth, in order to be able to get them through that process, because it's like anything else, you don't know what you don't know.
Yeah, and that's correct.
Right.
For a lot of folks, that's the whole educational process of getting there for them. And it's interesting that if they've had a business for a couple of years, they'll come back if they want to start another, because they realize the whole licensure and regulatory process of getting them started up and prepared, it's just a real time-consuming distraction for them if they're already in business. So we'll get those who have started a business that'll come back and want us to start another one for them. and they're much more educated. They know what they're doing, so they much less hand-holding.
Right, right. I would imagine, though, at the same time, because regulations change, legislation changes, that there's always things that are in process, right? So even if I come back to you to start a second or a third agency, as I know a lot of people do, you still are going to be bringing new skills and information and assistance to the table, regardless of how many experiences I've had as an entrepreneur, as a business person.
That's correct, and it can range in depending on the level. Like home care, for example, which is personal care or companion care, there may not be as much regulatory environment that, say, a Medicare certified home health agency would have, but they still will have shifts. Like the state of Connecticut, for example, right now is going through a process where there was no licensing requirement, and now they're looking at moving the licensing under the Department of Health so that there will be a licensing component. So that's a big regulation change for that environment. With Medicare certified home health agencies, CMS is releasing changes to the billing manners and guidelines and everything that goes into that. So there's constant change that they have to be aware of, and especially with some of the COPs. There's a new COP for enrollment and how they go about that. So that's,
for our viewers, what is COP?
it's a condition of participation. So those are the requirements that they have from CMS to be able to meet the requirements for patients to be reimbursed through Medicare.
I can only imagine. I'm sitting here listening to you talk about this, and it's like a foreign language, I would think, when people first approach the idea of starting a business. So the value of good consulting services that 21st provides would be indispensable. Somebody's got to be able to help somebody learn the lingo, so to speak, and then actually help them execute the process. What accrediting organizations is 21st Century affiliated with?
Well, for the home care industry, there's primarily 3 accrediting organizations, and that's ACHC, CHAP, and the Joint Commission. And we work extensively with all 3 of them, so that if somebody wants to get accredited for Medicare, they can either go through the process with Medicare themselves, or typically they'll go through an accrediting organization to help them get their survey and get prepared for it so they can reach that accreditation.
Is the accrediting process something that is always changing as well? Is that driven by the, what's the word I'm looking for? Is it driven by the particulars of compliance, the legislation, the rules and regulations? Do people come to you knowing that you all are abreast of all of those pieces of information so that they're having put into their process what they need to do, what they're trying to do as individual business people, as individual agencies?
I wouldn't say there's that much change that frequently for what they need to do for survey. And each accrediting organization is a little bit different. For example, ACHC has more specified standards that they want the agency to follow. The Joint Commission, which is very heavy in the hospital space, the acute space, has much more regulations with it as well. So their standards are a little bit higher. And CHAP, which has the same standards, similar standards, but their focus is more on the process that the organization is using. So each one has its own nuances on how to be successful with preparing for those surveys. And I think that's where we can really come in, and because all of our clinicians and people that assist with that are certified by the accrediting organizations to be a certified consultant.
What other industry associations does 21st Century hold?
So we're a member of the national associations, which the national NAHC, the National Association for Home Care, and NHPCO have combined now to create the Alliance for Care and Home. That's the main, largest, I think, national organization. So we're members of that. We're faculty on the committees, and we speak at the conferences and present a lot of business-related topics as well. The Home Care Association of America is much more geared towards a lot of the franchises, I think, are members of that. And we're, again, members and engaged there. And then in all the state-specific agencies as well. So, or not agencies, excuse me, the state-specific associations. So we're members of the California Association, Texas Association, New Jersey, Pennsylvania, Indiana, Maine, Massachusetts, just all over. So we are members of the state associations, and we like to participate with them as well. So we're not just members, but we like to contribute. So we're on the different education committees and finance committees, things like that. So we participate with them, and it's our way of giving back to the community where our clients are members as well.
How do you incorporate technology into all of this? What technology does 21st bring to the table for the agencies that you support that gives them a leg up, that gives them better odds at success in starting their businesses?
But that's a good question. And from a technology standpoint, typically the home care agencies, when they're first starting out, they don't have the same level of funding or resources that an agency that's in business has. So we have to identify service providers or technology providers that they can team up with that are going to have the pricing structure that's suitable for a startup. So we partner with Allura for EMRs so that they can have an inexpensive way to get into using technology there. Symmetry with billing and a few others.
What technology is 21st Century bringing to the home care community?
Actually pretty excited about that. We've been developing it for over a year now, and it's Nexin.com, Nexin.com, and it's an online policies and procedures and a compliance tool. So for example, all of your policies and procedure manuals now can be housed on this electronic application that we have. It's a document management system / learning management system. So we can house all the policies and procedures for your agency. It also has where you can upload your own specific policies and procedures or any other documents that you want for your staff. And the compliance component is the administrator for your agency can then assign those tasks out to caregivers or anybody in the organization to get them familiar with it. They go through the training on that particular policy, and then they can do their attestation within the system, and it'll report back up. So now a director of nursing or an administrator can ensure that everybody in the organization is trained on specific policies that they want them to have. So as they're onboarding new caregivers, or if there's a specific change that they want to update everyone on, it's a great compliance tool for them to be able to do that. And it also has integrated learning management systems so that many of their CE credits and educational programs that they need to have for their ongoing certifications is available to them through the system.
So your agencies have access to Nexin by virtue of being clients of yours?
Yes. Yes.
Is that part of the services in general, or is that a specific area of investment for your clients and also of deliverables that you all have for the people that are interested in becoming Nexin oriented?
Well, it's interesting in that everybody that goes through our processes from a startup perspective needs policies and procedures. But at the same time, every agency out in the U.S. needs their policies and procedures, and they've got to be state compliant. They have to be, if they're accredited, they'll have to be aligned with the accrediting organization. They've got to meet the CMS requirements. So that there's a lot of information that goes into each specific agency type and the manuals for it. So we create that. We have a great partnership with Paul Sinelli Legal, which is known throughout the entire industry. So we have all of our HR and legal policies and procedures are written by Paul Sinelli for inclusion within the manual. So they have that access as well. And again, they can get more information. They can dial 855 Nexin HC. So it's Nexin HC is in home care. It's an easy way to remember it. Or they can go to Nexin.com.
So now let's talk about from the human side of things. We've talked about technology. We've talked about goods and services. We've talked about the history and 21st century's position in the marketplace. As a CEO, what do you think about when you're not sitting behind your desk and you're thinking about the people that you service in the field, those people with dreams that are starting, hopefully, legacy businesses? They're thinking down the line for their children, their grandchildren. These are people who have taken a risk, probably. They've either borrowed the money or they've saved it, and now they're bringing all their eggs to roost in one basket with 21st Century Healthcare Consulting. What do you have to say to them to help them understand that you are the company that's best suited for their needs now and also in the future?
Great question. And a focal point to that is it's not just the startup component, because we do a lot of existing agency ongoing consulting to help them with their sales, their marketing, business management, financial management, things like that. Mm-hmm. So there's a lot to learn, especially payer sources, how to expand and grow their revenue streams. So I think that's a big focus that 21st Century has, is that we can help somebody start up. Anybody can hang a shingle, right? Once you go through the process and you get your doors open, how do you gain customers? How do you grow your business? How do you become successful? I mean, that's the component that we look at the most. It's a big investment to open an agency, mm-hmm. but how do you take that investment and then grow it? How do you get out into the market? How do you get those skills to be able to develop your referral base and to find additional payer sources, mm-hmm. and to diversify and to get creative ideas? And that's not just generally speaking across one size fits all. You have to look at the specific demographic and market that agency is in, and what's the what's the best payer sources for them. If Medicaid's a low payer source, but they're in a lower income area, they may be able to acquire a lot more customers and be able to build their business on volume. If they're in a very high net worth area, then they may want to look more at private pay and how to get into private duty type arrangements. And that's with VA, long-term care insurances, mm-hmm. Other private insurances, or just private pay. So there's a lot of opportunities there. So it's really looking at what does that business person need to make their business successful? How do we keep them abreast of what's changing? When CMS implements a new rule change and they're going to modify the pay structure, how do we get them ahead of that? How do we get our agencies aware of it? And not just aware that there's a change, but how do they implement what they need to do on their side to be proactive and ahead of that curve so it doesn't hit them negatively?
From a continuing education standpoint, how does 21st Century help equip your agencies to be able to continue to grow, not just in the near term, but also to be able to put out those long-term goals and be able to keep people in the know so that they can actually achieve what they're trying to do?
Right. So multiple ways. First thing, we run a monthly boot camp. I can speak. But they
have a show similar to that in Great Britain. It's called The Great Bake Off. It's boot camp, bake off.
It's close. It's the same thing.
Same
really.
idea.
Yeah.
Okay.
So we run a boot camp once a month, and that's an intensive 4-day on-site training where we can take them through a lot of everything that they need to know for their business. Mm-hmm. We're extending that out as well. We're having more business fundamental courses now so that they can come back for those educational opportunities. And a part of what we do with the state associations is we produce webinars and presentations at their different conferences so that we can put that information out, and we record it. We have Home Care University where our clients can go and see all of this information, and it helps them with development. So
it's really, I get the sense listening to you that 21st Century Healthcare Consultants is like, it's like a home base for people who are starting, growing, expanding their agencies in the home care community. It's not just a one and done. You build long-term relationships with your clientele. You're there for them, not just now, but as not just as they move on, but as you move on through following the legislative changes, compliance issues, and so on and so forth. So you're a team, but I would even go so far as to say some people might think of it as a community, where you have not just the clinical side of things, but you also have people who care about what they're doing here at 21st to be able to assist those caring out in the field for what they do. And I think that is a hallmark of 21st, if I might be so bold as to suggest. It's what sets us apart. We give people not just the help that they need mechanically, but we actually invest into their businesses and their lives and to the stars and beyond.
Yeah, I would say I would agree. I think that's a great way to capture it. I wouldn't say we invest in their businesses, just so there's not a confusion. If somebody says, hey, can you come invest in our company? Mm-hmm. I think we invest heavily in the training programs that we develop. and the core functionality of things that will get them moving in that right direction. So that's a big focus, is that yes, we want, and let me step back and say one of the changes. So for many, many years, the focus was, it started with getting people accredited, right, to help get through their accreditation survey. And then as people found the need for, could you help with licensing, the business expanded into these other areas. And to where in the past several years, we've changed that focus to where it's not just get businesses up, running, out the door, but now how do we do that? How do we develop that community to where people can come back and continually add on to their layers? So as they realize, okay, my doors are open now, I've passed all my surveys, I've got my license, now what? Now they're able to come back and say, I need help with really taking my marketing. I got that initial step, but now I need to train my salesperson on how to go out and market our services. And once they do that, then we can also help them expand on what kind of payer sources or what referral sources can they start to look to now to expand and grow with that as well. So yes, it's really, we're putting a lot of investment in the programs for post-opening so that we can help them grow their business. And it's common. 70% of all home care agencies in America are below the $1 million in gross revenues. So it's interesting that it's such a large amount of agencies that are bringing in so little revenue. I was meeting with a client that has been open for several years, and they felt good that they finally achieved $300,000 in gross revenues. With a minor change in how they're going about developing their referral sources and looking at the data, we can see them get exponential growth to get 2-3 times with that. So that's the benefit of where we're able to look at now where they're at and how to really help them get to the next level. And I'll add, some of our competitors, there's varying levels. There's 4, maybe 5 consulting companies that are in that startup space. Most of them are smaller. There's maybe regional. They maybe do 2, 3, 4 states, or they focus in home care, not home health, whatever. But that's kind of their focus, is mainly just the startups. Then there's the much larger companies that, the WellSkys, McBees, Symmetries, that have extensive consulting, and that's much more in depth on their billing, their revenue management, RCM processes, different things along those lines, that much more expensive, that for much larger and more successful agencies. Mm-hmm. So us to be able to bridge that gap for where people are in that, they're open, and they may have been open for 3, 4, 5 years, but they can't find their way to get into a 7-figure revenue. Mm-hmm. And that's where we can come in and help them do that.
In the couple minutes that we've got left, I'd want to ask, what is, as the CEO and the president of this company, what is your vision that you cast for the people that work here at 21st, for your leadership team, for your sales team, for your marketing team? What is it that you communicate to them from the top down that gives them a sense of where 21st century is going, and why?
Great question. And I think that's something that we talk about because we want everybody to have the shared vision of what we're doing. So how we've changed our focus from mainly on the startup side of the business to get into more, how do we make those businesses successful? How do we create business success ongoing for them in the future? So that our expansion of services and depth that we've brought in for that is one big driver. And then really with our Nexen platform, because that bridges every agency out there. And it's not just within our vertical of the home care industry. There's other similar industries as well that we can provide that to. So that's the growth from the technology side and how we can enable better compliance and development for agencies.
Well, equipping and enabling, that's key. I mean, regardless of what business you're in, if you don't know how to make something happen, and let's face it, when you start out, there's a whole lot to learn, and stuff changes as you go. You need to be able to keep up with it. So it sounds like 21st Century is able to do that on a consistent basis, and not just because it drives to the bottom line, which of course it does. I mean, let's be honest, right? Nobody's in business who doesn't want to make money. But it sounds to me like 21st has an even greater vision than that holistically for the people that you help and the people that you serve on an ongoing basis. Is there anything else that you'd like to share with our viewers before we wrap things up?
Yeah, that's an interesting comment you just made. So I'll add one of my favorite quotes that I hear is, you can't be philanthropic if you're poor. And I think the key point, you hear a lot of people that get into this industry because they care. They care about people. They care about our seniors. They care about our medically fragile children. There's a lot of different people that are cared for by the home care industry. And I think that's a wonderful compassion to have, especially from a nursing or medical background. But the key point for business owners is to remember that, yes, ultimately this is a business. Mm-hmm. So for them to be successful and for them to continue caring, they have to care just as much about their bottom line as they do patients. So it's finding that balance. We help them with both aspects.
Thank you. Thank you for taking time out of your busy schedule to stop by and share, not just from your head, but also from your heart. I think our viewers will appreciate your insight and also the deeper explanations into 21st century healthcare consultants. The services are top drawer, and we're grateful to be able to extend that to anybody who's interested. And I hope that in listening today that you all have had your curiosity tickled a little bit, or maybe you've had some questions answered that you've wondered about. Maybe you're ready to take that step. Check out Nexen at nexen.com. Check out 21st Century Healthcare Consultants. I'm Kate Rose. I've been your host, and I hope that we get to see you again. In the meantime, take good care.